We touch every patient that enters the Mary Greeley's doors, from the ER to the inpatients to the OR. Radiology services are involved in one way or another. And we capture images to help diagnose and treat all sorts of medical conditions.
So this is a CT scanner. Basically, we get 3D images of any part of the body that we scan. Do you have any questions at all, hon? Okay. I think the first step is when somebody comes into your room, try to form a little bit of a relationship with them before you move on. So do you have a boy or a girl?
I have a little girl. Yep. And then I have another little girl at home, the 1-year-old.
No. Does she like being a big sis?
Well,
She's not so sure yet. You know, you get an opportunity to really work one-on-one with a lot of the physicians. The radiologists rely on us a lot to be able to know what we're looking at, to grab them if need be. I'm just gonna go show one of my radiologists real quick, and then as soon as I have the okay, we'll get you out of here, okay? No 2 days are the same. You never know what's gonna come through. You're never bored.
We have diagnostic x-ray equipment that we service ER, inpatient, outpatients. We have fluoroscopy machines that we use to capture movement. We have MRI scanner that we utilize magnets to capture soft tissue structures and detailed imaging of patients' habitus.
Patient safety in MRI is super important to us. It's one of the first things we learn when we're learning MRI. That's why we are always asking providers and patients multiple times what they have inside their body. Older pacemakers or even leads can be unsafe to go into the MRI scanner. So we have to make sure that those are safe, and that can take, sometimes it can take days to figure out. It can take a couple hours to figure out depending on what patient information we have in their chart. It's just one of those things that we really have to know before we let the patient go on the scanner.
We also have our ultrasound machines that uses sound waves to visualize parts of the anatomy, as well as our nuclear medicine cameras.
Since we are exposed to radiation, we are monitored monthly, and we do wear a body badge. And unlike anybody else, nuclear medicine also wears a ring badge. We do have a little more exposure than CT or X-ray does, unless they do maybe IR, and that's just because we're injecting the radioactivity.
We continue to forecast where technology is going so that we can stay up to date on the most advanced service options.
We provide screening and diagnostic mammograms here at Mary Greeley. This allows the radiologist to have clearer images to be able to get a more detailed look at your breast tissue and to be able to diagnose breast cancer sooner.
For me, it was pretty easy growing up in a small town. My mom is an X-ray technologist, so I participated in many sports, and so when I was younger, she'd get called out. I would go with her, so I kind of became fascinated with the technology. Typically, when we get a new piece of equipment, specifically CT or MRI, at least 2 or 3 of the technologists go off-site to a school for 4 to 5 days where they're able to get firsthand knowledge of how the machine works. In addition to that, we also bring somebody on-site once the scanner is installed for usually a full week, and then do a follow-up week. We're all within the same department, helping each other out, whether it be helping lift a patient, help maybe start an IV for another department. So we're kind of always integrated with each other, kind of as a close-knit bunch.